So chaired a great session yesterday, rapid clinical updates. I think we saw some really exciting data in potentially a few areas. First and foremost, we saw some follow-up data from Dr. Vicky Macker at Memorial Sloan Kettering on Lenvatinib plus Pembrolizumab in advanced refractory endometrial cancer. And I think, what we really saw there was the emergence of this really strong signal for MSI high cancers and endometrial cancers, with really impressive overall survival, though the numbers were quite small, only 11 patients with either MSI high or DNA mismatch repair deficient tumors, but overall survival not yet reached in that group. So I think that will be really exciting to see that play out as we see some longer follow-up. No additional safety signals, also really encouraging. Obviously, we know that combination has been somewhat difficult to tolerate in the past. I think the other really exciting update we saw from that session was Dr. Martin Bernke from Dresden talking about a novel type of combination with ICT01 plus Pembrolizumab. And while there were mostly stable disease and stable responses seen, presented a case of a PD-1 refractory melanoma with an intercranial metastasis that actually completely regressed following a period of pseudoprogression. So, I think, again, very early data, they're still in dose escalation, but, some exciting data to come from the EVICTION trial as well.